So what we'll just cover some of the basics for now in the short time that we have before you actually go on to the more formal education session where you learn a lot more about things. First of all, looking at your weight, I noticed today that you are a bit overweight, maybe stone and a half, possibly. Your BMI, known as your body mass index, is also 28. This is a measure where we look at the height over weight, and it tells us that you are overweight. The body mass index is around about 25 is below is the normal range, so at 28 you are a bit high. That's not surprising because weight is very closely associated with type 2 diabetes. And the vast majority of people with type 2 diabetes are going to be overweight or obese. So therefore, looking at diet and lifestyle is going to be very important, because if you can lose a little bit of weight, the diabetes often gets much easier to control and probably means that we need to use less medication. The reason for that really is that your body makes a hormone called insulin. And insulin is the major hormone that regulates blood glucose levels. In diabetes, there's two main things tend to happen with type 2 diabetes. One is your body perhaps doesn't make quite enough insulin, and therefore blood sugar levels can creep up. But also the insulin that you produce doesn't always work as well as it might do. And that's what happens when you put on weight. You get a little bit resistant to insulin, basically meaning the insulin isn't working quite so well. You're not quite so sensitive to the insulin if you're overweight. So if you can lose the weight, your body becomes a little bit more sensitive to insulin and your diabetes can improve quite a lot. So therefore, concentrating on your diet and lifestyle with a view to losing weight can have a big impact on your blood sugar levels.
Can I cure diabetes then?
Well, if you can lose weight and you can lose a significant amount of weight, there is a possibility that the diabetes may disappear. It doesn't necessarily mean that you're cured of diabetes, but it might mean that the diabetes is reversed, i.e. your blood sugar levels are now back to normal range. It's likely that the diabetes may well come back in time, but it's certainly much better for you in the longer term if you can keep blood sugar levels as normal as possible, and by losing weight that can make a big difference. Particularly important for you coming from the South Asian origin, because with people from the South with the South Asian ethnicity, having extra weight has a bigger effect than the white population. We're not sure why that is, but we do understand that when you put weight on from the Asian ethnicity, you tend to get diabetes more easily than if you put weight on from the white population. So particularly for people from the from South Asian population, losing weight and controlling weight is more important to try and achieve. And the question is, how do we go about losing weight? Well, of course, that's down to food, diet and exercise, which you'll learn a lot more about when you go to the education session. What about medication? Well, we don't want to give you medication too soon, and we would sooner you try and manage things from a lifestyle point of view. However, I think at this point there is some medication that would be very useful for you to take, and this is a tablet called metformin. Now, metformin has been around for many, many years. It's a very old drug, but it's a very safe and well-known drug, and it does help to control blood sugars very nicely. And what metformin does is it doesn't work on insulin particularly, but it does help improve your sensitivity a little bit to insulin, and it helps reduce glucose release into your body. Your body stores lots of sugar, particularly in your liver, and these glucose stores are regulated by insulin. Now, if your insulin levels are a little bit low in your body, is what happens in type 2 diabetes, then these glucose stores can be released when you don't particularly need them. So your body is releasing glucose, elevating your blood sugar levels. Metformin tries to slow down this process, so it tries to slow down the release of glucose back into the bloodstream, particularly from the liver, and therefore helps control blood glucose levels. It's very useful also because it doesn't cause any weight gain. Some medication can, metformin doesn't. The slight downside to metformin though, in some people it can cause a little bit of tummy upset, maybe a little bit of diarrhoea. So what we'll do is start you with a small dose, which is a 500 milligram tablet once a day, and then we slowly build up the dose over a period of a week to 2 weeks, aiming for 2 tablets with breakfast in the morning and 2 tablets with evening meal in the evening. We will then monitor your progress, and then obviously we can then add in further medication if required over time.
Any side effects with metformin, Joe?
The main side effects, as I said, is this maybe a little bit of tummy upset, a little bit of diarrhoea
Right.
is the main thing.
Okay.
Some people do get those side effects. If it is that you can't tolerate it, you're getting upset tummies, you get diarrhoea, then obviously we'll stop it and we'll try and maybe look at other medication.
That's great.